issues. So welcome everybody. If you don't know me, my name is Lee. I am one of the guides here at GetSetUp. This is the second edition and it is brought to you by CoverRight, who we're going to be talking about how to navigate Medicare. This is again, part 2, evaluating plans and cost. So as a community of active adult older learners who are looking to stay informed and connected, GetSetUp is thrilled to have Richard from CoverRight with us this evening to lead us in part 2 of a 3-part series of how to navigate Medicare. Before we get started, I wanted to cover a few housekeeping items. During the first part of the program, Richard will be sharing a presentation. And if you have any questions during this part of the program, you can put them in the chat so you don't forget them. And the second part of the program where we can ask questions, you can raise your hand to ask questions or ask them out loud, or just place them in the chat, which is on the right side of your screen. And I will read the questions from the chat to Richard. We'll do our best to answer all your questions this evening. And now on to the special guest. Richard is the CEO and co-founder of CoverRight, a content writer and a licensed insurance agent focused on Medicare. He's based in New York and is passionate about empowering consumers to take control of their health and finances. Richard has extensive experience working in the financial services for the last 8 years in this industry. What is CoverRight and what will we be covering this evening? CoverRight.com is a digital-first health insurance platform focused on Medicare. The company's mission is to make Medicare more transparent and accessible for over 60 million American with Medicare beneficiaries. They aim to simplify and traditionally the confusing and complex decisions by delivering you a simple, delightful, and comprehensive enrollment experience. This is part 2 of a 3-part series. And if you weren't able to join us last week, that's okay. We're happy to have you join us this evening. What we'll be covering this evening: determine which plans are right for your needs, calculate what your Medicare costs will be and how to evaluate out-of-pocket and non-covered cost, and evaluate if a 0 premium plan is right for you. So welcome, Richard. We're glad to have you, and the rest is yours.
Thanks, Lee. And hi, everyone. I'm really glad to be back again for part 2 of this series. So I will be presenting some slides. Give me one moment here. But yeah, I'm really happy to be here. The agenda today is basically to go through some of the key terminology for Medicare. The costs that you need to evaluate when you're thinking about Medicare plans, some of the differences in the supplemental costs and the supplemental coverage that you can get, and a discussion around what might be right for you, because Medicare is really not one size fits all. Before we do that, I know Lee already covered this, but just as a quick overview, like Lee said, we are the first purpose-built digital concierge platform for Medicare, and so our goal is really to make the experience as simple as seamless as possible. We're really excited to be working with GetSetUp. I think we have very similar missions in really empowering consumers. And so, again, I'm really excited to be here. If you ever want to visit our site, there's a lot of things you can play around with. And if you want to shop plans, we help you match your doctors, your benefits, your drugs, and you always get a dedicated agent from beginning to end. So we don't put you through switchboards or anything like that. You always talk to the person that's been allocated to you. And more importantly, the whole service is 100% free. We don't charge you anything. There's never an obligation to enroll. So always feel free to reach out if we can help with questions. So with that, moving into the actual content of today's session, I think a key statistic I came across the other day that was really interesting is that 9% of Americans surveyed by United Healthcare in a recent consumer survey showed a lack of basic understanding of the 4 key health insurance terms, being premiums, deductibles, coinsurance, copays, and out-of-pocket maximums. So I think what we're going to do today is make sure we cover that with you so that you are not part of the 91%. I think a lot of you probably aren't anyway, but making sure we cover the bases before we get started. So some of these terms you might have heard of before with health insurance when you're working, or the other types of insurance that you have. Premiums, obviously the periodic payment that you pay monthly in order to have any sort of insurance in place. As it relates to Medicare, there are a few ways you could be paying for premiums. One is the underlying original Medicare, and we'll go through that. And then the other is the supplemental coverage that you might be considering as well. The second is deductibles. When we talk about deductibles, a lot of people get this confused with your maximum out of pocket, which is what we'll cover on the next slide. But a deductible is really the amount you must pay for services under that are covered under a plan before the insurance actually kicks in. So you pay 100% of the cost for services up to the deductible amount before insurance kicks in and helps to cover some of the costs. The next one here is copays and co-insurances, which we'll also be using today. Again, people get these mixed up. They're actually largely talking about the same thing. The difference between a copay and a co-insurance is that one is a fixed dollar amount. So when we talk about a copay, we'll say a $5 copay or a $10 copay. When we talk about a co-insurance, we'll be talking about 10% of the costs or 15% of the costs. So that's really the main difference between a copay and a co-insurance. And all it means, it's the amount that you might be required to pay to share in the costs of the services that are being covered by your insurance. And the last one here, like I said, a lot of people get confused with the deductible, which I mentioned earlier, is the out-of-pocket maximum. The out-of-pocket maximum, if you ever come across this term, is a cap or a limit on the amount of money you have to pay, which includes basically your deductibles, your copays, co-insurances for covered healthcare services in a year before the plan pays for everything else for the remainder of the calendar year. So it is not a deductible. A deductible is what you have to pay first before insurance kicks in. An out-of-pocket maximum is the total amount of money that you spend out of pocket before the plan covers everything else. So those are the four key terms before we sort of dive into the different parts of Medicare and the costs. Okay. Now, if you guys were here last week, we would have gone through this slide where we broke apart the ways to get your Medicare coverage. And there are two primary ways that are exclusive to each other. And the first way is to stay in original Medicare, which is have your hospital Part A, hospital Part B directly from the government, purchasing a standalone drug plan to help supplement any prescription drug costs, and potentially also purchasing what's called a Medicare Supplement or a Medigap plan, which helps to cover the out-of-pocket costs, such as the copays and co-insurances that you would otherwise have to pay under original Medicare A and B. That's one way to get your Medicare coverage. Probably about 20 or 25% of the population of Medicare beneficiaries will get their coverage this way. The second way to get your coverage primarily is what's called Medicare Advantage. Medicare Advantage plans are an alternate way to receive your Medicare coverage. They are also provided by private companies, which is kind of confusing sometimes because you see private companies on both sides of the divide. But a Medicare Advantage plan is very different to a Medicare Supplement plan. When you choose a Medicare Advantage plan, you are proactively making the decision to take your Medicare coverage directly from the plan rather than from the government. So what happens is the government pays this Medicare Advantage plan a subsidy to help deliver you Medicare. A lot of Medicare Advantage plans are bundled, and we'll go through what that means when I say it's bundled, but they come with prescription drugs, they come with things like dental vision benefits. And if you're watching TV, the Medicare Advantage plans are going to be the ones that you probably see advertised a lot. They're also going to be the ones that are called the $0 premium plans, and we'll cover that as well today. So when we're thinking about the two sides of Medicare that I just went through, there are some key differences in the costs. And when we talk to clients about going through this process, it's really important that you decide which side or which way you want to take your Medicare coverage. And so part of that consideration is how you think about costs and what's your personal budget. So the first thing to note is, regardless of if you want to stay in original Medicare or if you want to go into a Medicare Advantage plan, you always have to pay your Medicare Part B premium. The Medicare Part B premium is the premium for the medical coverage that you sign up to when you're 65 for original Medicare. But if you choose a Medicare Advantage plan, you also still have to continue paying that premium. So when people say a Medicare Advantage plan is a $0 premium plan, what it means is it's $0 in addition to the 107. So the Medicare Advantage plans are not free. You still have to pay your Part B premium. The second cost to consider is drug costs. An important thing to note here is, again, whether you're on original Medicare or you go with a Medicare Advantage plan, you will have to have drug coverage on either side. The drug plans work very similarly in the way they cover drug costs. The first difference, though, is that if you're in original Medicare, just with the A and B, you'll have to purchase a standalone drug plan. Now, what that means is you're buying a separate policy that covers your drugs. It typically has a premium that ranges from $7 to $99. On average, most people pay between $7 to $40 premium, depending on the types of drugs they're getting covered. That's different into a Medicare Advantage plan, where the drug plan is bundled into the plan, and there's no additional cost for getting the drug coverage for a Medicare Advantage plan. The second part of drug costs, which is probably more important than the premium, is your out-of-pocket costs for those drugs. What I mean by that is when you pay the premium to have the policy in place. But when you go get your prescriptions, there are going to be copays and coinsurances and potentially deductibles when you go get those prescriptions. The way they are covered are similar on both sides, original Medicare and Medicare Advantage. They're both considered Part D drug plans. And I'll walk through the details of that in a moment. But when you're considering your drug costs, the main difference between staying in original Medicare and a Medicare Advantage is that one has an additional premium and the other typically has that bundled within the plan. The next cost to consider when you're deciding on which side you want to go with is the healthcare costs, which is probably more important than the drug costs for some people. If you want to go with the original Medicare option and buy a gap plan, the gap plan comes with an additional premium. And the reason for that is the gap plan is considered very comprehensive, or sometimes called Cadillac coverage. And I'll go through what that means later in this session. That's in contrast to the Medicare Advantage plans, which I mentioned earlier, typically have a $0 premium, which again doesn't mean they're free. It just means that you're not paying anything in addition to your Medicare Part B premium. That's $170. And again, that's because Medicare Advantage is just considered an alternate way to get your Medicare coverage. You're getting your coverage from the plan, not directly from the government anymore. And then the second difference between the two sides is if you go into the original Medicare, and this is where the biggest difference for most people will be, is if you get a Medigap plan, that's the $99 to $300. What you get in return for buying that Medigap plan is very minimal or limited out-of-pocket costs when you use healthcare services. So what that means is year in, year out, when you're thinking about your healthcare costs and what your risk and what your exposure is to healthcare costs, it's really your monthly premium that you're paying for your Medigap plan, because the Gap plan will basically pay for majority of your out-of-pocket costs that you have to pay under original Medicare. So year in, year out, you're just really thinking about your Medigap premium. You're thinking about your Part D standalone drug plan premium, plus any out-of-pocket costs for those drugs, plus your baseline Medicare Part B premium of $170. On the Medicare Advantage side, this is where the biggest difference is to staying in original Medicare. We mentioned that there's no premiums for the drug plan. There's no premiums on top of the $170. It sounds amazing. But the reason that that's the case is Medicare Advantage plans make you share healthcare service costs until you hit a maximum out-of-pocket each year. So what that means is when you use a Medicare Advantage plan, the plan will say you have to pay copays, co-insurances, $5 to see a doctor, $200 for an outpatient surgery. You keep paying those copays until you hit the maximum cap, which ranges from about $3,000 to $11,000. It depends on your geography and where you live, until the plan covers everything else. So the key biggest difference between staying in original Medicare, getting a gap plan, and a Medicare Advantage plan is how comfortable are you with the dollar risk in a catastrophic scenario. And so what I mean by that is if you are in original Medicare and you have a gap plan, you have very minimal out-of-pocket costs because the gap plan will pay for most of your healthcare costs. So again, that gives you very comprehensive coverage, which means year in, year out, you're not worrying about this big bill for healthcare services. However, you have to continue paying your monthly premium for the gap plan, which is in addition to the $170, and that ranges from $99 to $300 a month. On the Advantage side, you're typically paying nothing for the premiums. You're paying nothing for the drug plan premium, but if you don't use any healthcare services throughout a year, you also pay nothing. However, if you have a bad year and you're using a lot of services in one year, your costs aren't capped until you hit the maximum cap of $3,000 to $11,000, depending on the plan. So what we always tell clients after walking through that is you need to kind of decide on a path that's right for you. There are pros and cons of being in a Medicare supplement plan with original Medicare versus staying in Medicare Advantage or getting a Medicare Advantage plan as an alternative. One of the biggest draws of people who want to stay in original Medicare with a Medicare supplement plan is that because you're staying on the default government program, you can see any doctor in the country that accepts Medicare. There's no doctor networks, there's no need to select a primary care physician, and there's also no specialist referrals. As long as the doctor accepts Medicare, you can go see them. In contrast, in a Medicare Advantage plan, because you've decided to take your coverage from that plan and not directly from the government anymore, that plan gets to dictate which doctors you see. So you'll have doctor networks. In some cases, the plan might be willing to cover out-of-network doctors, but they might cover at higher costs. But they basically get to say, yeah, you're able to see, Dr. A, but not Dr. Y. So that's one big difference. The second is what we've been talking about so far, which is the cost difference. So when you're in original Medicare and you buy that Medicare Supplement or Medigap policy, which is sometimes called, to pay for the out-of-pocket costs so that you have very limited and no out-of-pocket costs, it means year in, year out, all you have to care about is the premium. So you're not worrying about, okay, if I go to the hospital, I have to pay a huge bill or things like that. The plan will cover it. That's different to Medicare Advantage, where it's pay as you go. So like I said, Medicare Advantage plans, if you don't use any healthcare services throughout the year, you pay nothing. You pay nothing beyond that $170 premium for the Part B. But if you start using healthcare services throughout the year, or if you have a bad year, then you don't stop paying out-of-pocket costs until you hit that maximum out-of-pocket number. The next difference, obviously, is the additional premium. So, the Cadillac coverage you get with the Medicare Supplement, it comes at a cost. You have to continuously pay that extra $90 to $300 premium each month in order to have that coverage in place. In contrast to that, Medicare Advantage plans typically have $0 premium. But again, that's because you're paying as you go and you take on more risk in a catastrophic scenario. The final difference is extra benefits. So if you're staying in the original Medicare program, if you want dental, vision, and hearing, you're typically going to have to buy that separately, as well as that drug plan. So that's one downside, which means there's extra costs to get some of the coverage or routine coverage that you're looking for. In contrast to that, the Medicare Advantage plans, and this is the things that you're going to see on TV being advertised, they are the plans that do come with the drug coverage bundle. They come with the dental, they come with some routine vision and hearing, and sometimes fitness and other benefits. So as you're weighing up, which side you want, I would say as a generalization, it's always hard to generalize because there's a lot of variation between geography. People who prefer peace of mind and can afford the extra premium and want the flexibility to be able to go anywhere in the country and get coverage will go with the Medicare Supplement option. That's why it's considered the Cadillac option. And for those people, they'd be willing to pay the extra dental, vision, hearing, or drug plans that they need to get in order to get that comprehensive coverage. On the Advantage side, if you're willing to stay in network, you don't travel a lot, you're relatively healthy as well, and or the maximum out of pocket in your geography isn't very high, call it like $3,000 will be considered low, then it might be worthwhile. The costs are typically low. There's normally no copays for seeing your primary care doctor. The downside is you have to get your care coordinated through that doctor. But, if you're relatively healthy, you're probably not seeing that doctor a lot in any case. And, if the maximum out-of-pocket limit is low, then your risk isn't too high. So there's two different ways to get your coverage, and it's really not one size fits all. When we do these conversations with our clients, it depends on their personal situation, depends on the types of plans that are available in their geography. And it also depends on their personal budget as well as their risk preference. So diving in a little bit more detail, like I said earlier before, whether you're in original Medicare or Medicare Advantage, one thing that you must check is your drug costs. That's really important because the way drugs are covered by different plans can change significantly. And that's because the plans work in a way where the prices that you get are really through a process of negotiation by the insurance company and the drug manufacturers and the pharmacies. So we've seen in the same zip code for some drugs that the price difference be up to 200 to 300% for the same drug. So if you're in the wrong plan, you could be paying hundreds if not thousands of dollars more. When we spoke earlier, if you're staying in that original Medicare option, there is that premium of $7 to $99, and the Medicare Advantage plan bundles the drug plan in at no additional cost. But what we said was the out-of-pocket costs are going to be probably the most important determinator of which plan you go with, or one of the biggest important determinators of which plan you go with, because the drug costs can vary so differently across plans. The drug plans all work very similarly mechanically. And what I mean by that is when you look at drug plans, whether it's a standalone plan or within Medicare Advantage, they're both considered Part B plans. So they work the same. Every plan will typically have some sort of deductible. The deductible means you have to pay that amount before the insurance kicks in. And typically you'll find that the deductible only applies to certain tiers of drugs. And so what I mean by that is the way drugs are covered by a plan is that insurance company will take a whole list of drugs. They'll cut and slice them into different tiers. More expensive drugs are typically in higher tiers, like generics in the lower tiers. And what they'll do is for a deductible, they might say your lower tier drugs don't have a deductible. So if you're getting preferred generics or generic drugs, we won't charge you a deductible for that. You get coverage straight away. On the other hand, if you're taking branded drugs or other sort of specialty drugs, then there is a deductible. So typically you'll see a plan say, $0 deductible for tiers 1 and 2, and then a $480 deductible for any drug that's tier 3 or above. And so that's what the deductible means. And then you'll have copays and co-insurances to get your prescriptions. There's a lot of complexity around that, and you should always reach out to an expert, particularly if you have expensive drugs, because there's a lot of calculations that flow into what your ultimate out-of-pocket costs will be. And it's not always going to be flat throughout the year. Some of you may have heard about the donut hole or the coverage gap. There are different phases of drug coverage. It all depends on how much you're spending on drugs each year. But the important point is to get an expert to help you calculate those to make sure you have a clear understanding of what your month-to-month costs are And like I said, it's not flat. It can change. It can be higher at the beginning of the year, low for a few months, and then higher for another 3 months. So it just depends on how your drug costs are calculated. But it's important. And when you're evaluating whether it's a Medicare Advantage plan or original Medicare plan, like when you're evaluating the drug portion, it's really important to make sure you fully understand the cost of the drugs. And so the next part here, we've spoken about drugs which you have to have across whether you're doing the original Medicare option or the Medicare Advantage option. Now we're getting into, okay, someone's decided I want the Cadillac coverage, which is staying in original Medicare, buying a separate drug plan, and getting a Medicare supplement, also called a Medigap plan. So before we sort of break down what Medigap plan is, let's first cover what are the costs if I were to just stay in original Medicare A and B without any sort of private coverage. If you're just staying in original Medicare and you don't sign up to any private coverage, there are probably 2 or 3 key costs that you really need to know. The first is with your Part A hospital coverage, there is a $1,500 copay that you have to pay to cover the first 60 days of your hospital stay. And that's each time you go to the hospital. So if you're just on original Medicare with no supplemental coverage, you go to the hospital in January, they admit you, it's $1,500, covers your first 60 days. If for whatever reason you have an accident and in September, you have to go back to the hospital and you're admitted again, it's another $1,500. So that's the key cost for Part A. And then once you pass the first 60 days, there is a per day copay that you pay of $358. The second cost that is really important to be aware of is for your Part B insurance. So original Medicare Part B is medical insurance. And so what that means is it covers everything that is outside the hospital. So that includes doctor visits, that includes ambulance trips, that includes outpatient surgery. It can include even the emergency room because you're not really considered an inpatient at a hospital yet when you're in an emergency room. For all of those costs, once the insurance kicks in for Part B, you have to pay 20% of the costs and Medicare will pay 80% of the costs. Again, this is if you don't have any other sort of supplemental coverage and you just had the baseline default government coverage, Medicare will pay for 80% of the outpatient costs. And the other cost is there's a $233 deductible for the Medicare Part B, which just means you have to pay that $230 first before Medicare will start paying 80% of costs for doctor visits and things like that. So on the Medicare supplement plans, there are a few options. There's probably 2 that are now the most popular. And the first one is called Medicare Plan G for Gary. What the Plan G covers is it is now the most comprehensive plan that you can get if you're newly eligible for Medicare. It used to be a plan called the Plan F for Fred. That's no longer available to people who turned 65 after 2020. Now it is the Plan G. And Plan G basically covers all the costs I just said, with the exception of the $233 deductible. So if you get a Medicare Supplement Plan G, you'll always still have to pay that $230 first before the Plan G kicks in. Once the Plan G kicks in, it will pay for everything else. It will pay for the $1,500 deductible for a short-term hospital stay. It will pay for the 20% gap or the 20% out-of-pocket obligation that you have to pay that the government isn't paying. So it's very comprehensive coverage. The next most popular plan, and I'll only go through 2 of these, is Plan N for Nancy. Now, the Plan N is the next most comprehensive. It's also one of the more affordable plans. The difference between the N and the G is really 2 things. With the N, there are some small copays if you ever see the doctor of up to $20 for a doctor visit and up to $50 for an emergency room visit. That's the only difference when it comes to outpatient services. Otherwise, it covers everything else exactly the same as the G. The other thing that the N doesn't cover is something called excess charges. What this really means is For doctors who don't accept the Medicare approved rate, they are allowed to charge up to 15% extra on top of the Medicare approved rate. This doesn't happen very often. Most doctors will accept the Medicare approved rate. I've never had a client tell me that a doctor's charged them more than that, but it is a cost that isn't covered. But for all intents and purposes, the main difference really between the N and the G is this copay that you have to pay when you go see doctors or you visit the emergency room. So up to $20 and up to $50 for an emergency room visit. The important thing to note is you're going to see a lot of plan carriers that do the Plan G, Plan N. All of the Plan Gs and Plan Ns and all of the Medicare supplement plans are federally standardized. What that means is a Plan G from company X covers exactly the same as Plan G from company Y. So you're basically just shopping for price in most situations. And so when you're comparing Plan Gs, you really should just be looking for, the lowest cost options. There might be some small, things here and there where, maybe you've had a bad experience with one company. And so you might go for the second lowest cost option. But from all intents and purposes, you should be shopping for price. And I just thought I'd give an example here. For someone who's in Dallas, Texas, female, 65, non-tobacco, the price of a Plan G at the moment is $106 per month. And the price for Plan N is about $80 a month. So the monthly difference is about $20 each month, or around $240 a year. So if you're trying to figure out, should I be a Plan G, Plan N? It depends again, on your budget. If you feel like, you can afford 106, and that's great, you should go with that. It's very comprehensive. If you want to go a little bit more affordable, the Plan N is $20 less, $240 a year. So it means you'd have to visit your doctor 10, 12 times to make up that difference for the dollar cost. But those are the two most popular plans at the moment. Now, going to the other side of the page. So we had the left-hand side, which is original Medicare. You get a supplement plan, you buy a standalone drug plan, and then we had the alternate, which was you can go in a Medicare Advantage plan. And this is a typo at the top here, so ignore where it says Medigap. So it's comparing Medicare Advantage plans. So Advantage plans take a little bit more time to go through and understand, because there are both quantitative and qualitative differences in Advantage plans, and it's important to make sure you cover both. Firstly, starting with the quantitative part. So Medicare Advantage plans, most of them have a $0 premium. 59% of Medicare Advantage plans in the country have a $0 premium, which means you don't pay anything in addition to the $170 Part B premium. They do range. Some of them do have premiums. You will see it go up to around $100, but 59% of plans have a $0 premium. When you're looking across different plans, like I said before, when you go into a Medicare Advantage plan, you're choosing to take your coverage from that plan. So that plan can dictate the copays that you pay when you go use different services. And so one of the things that you're going to be comparing is you're going to be wanting to look through that menu of options that they have. So they all have a brochure, they all have a list of costs for standardized services, such as seeing your primary care doctor, seeing a specialist, hospital costs, and things like that. They'll all be slightly different. And it's important that you check those costs to make sure that you're comfortable with them. And the key costs are going to be the similar groups that we spoke about earlier. You're going to want to check if there's a deductible, which means that is there any amount that you have to pay first before the plan kicks in. Most plans have a $0 deductible, but some plans do have a small deductible, which means, if it's a $750 deductible, you will have to pay that first before the plan kicks in. The second is the cost sharing. So a good example is, primary care physician visits. Some plans, they'll say it's $0. You can visit your primary care physician as much as you want for a $0 copay. Some of them will say it's a $10 copay. And same for specialists. Some might say your specialist is $15. Some might say your specialist is $35. So it ranges. The plan can decide what that is. And it's important for you to determine whether that's appropriate for your needs. And the last one, and probably most important, is the maximum out-of-pocket cap. This is your catastrophic risk exposure. So In a very bad year, if you spend a lot on healthcare services, this is the maximum that you'll be paid. That ranges from $3,000 to over $11,000, depending on your location, geography, and plans, like I said before. But it's important to check that, because that's going to be, you know, if you have a bad year, that's the one that's going to catch you. And there's the drug costs, which again, we spoke about earlier. Each plan will cover drug costs differently. And so that's going to be one of the bigger considerations when you're picking plans and filtering plans down. Which plan, because the drug cost is bundled, will cover your costs at the lowest. So when you're comparing Medicare Advantage plans, there's these quantitative factors that you're looking for to compare. And there are also qualitative factors. One is doctor networks. You may have heard of HMO and PPO plans when you were in group insurance or had insurance from your work. Those concepts do apply in Medicare Advantage plans. HMO plans are plans where you have to stay in network. You cannot go out of network except for an emergency situation. And you need to select a primary care doctor, that you need referrals for specialists. PPO plan is a plan that also has a network, in the sense that there's a preferred network that you're supposed to go to that will give you a lower cost share, but they'll cover doctors that are out of network, but at a higher cost. So there are different types of doctor networks that you can get with a plan. And the second, I call it qualitative. There is some quantitative elements behind it, but it's the extra benefits. Like, what are you looking for with the extra benefits within a Medicare Advantage plan? Do you care more about dental? Do you care more about vision, fitness? Or do you care about having telehealth or over-the-counter allowances to help you buy things at the pharmacy that aren't covered under your Part D plan? The benefits are getting better each year. These are the benefits that you see advertised on TV, the grocery cards, the flex cards. That's all these sorts of benefits. The key thing to note is, whenever you're asking for more extra benefits or more flexibility in your doctor network, your cost share on the quantitative side is going to be higher. So if you ever see a plan where it's like, wow, it's got $4,000 of dental, just make sure you come back and look at the quantitative side and go, well, is it because now my maximum out-of-pocket cap is $11,000, whereas if I only had $1,000 of dental, my maximum out-of-pocket cap is $4,000. So, you know, the plans aren't free. If they're giving you extra benefits in one area, they're taking it out of somewhere else. So that's really important. You know, we have clients come through and, you know, they just really want the highest dental plan that they can get. But, you know, we have to warn them that that's all well and good, but, you know, your out-of-pocket costs when you actually go see the doctor could be very, very high. So that's really it. And in terms of like the key costs for Medicare and how to compare plans, whether a $0 plan is right for you, we just mentioned that in sort of Medicare Advantage, really depends on your situation. The one thing I wanted to say is that, you know, there's going to be people who also have Medicaid, which is state health insurance assistance for people with limited resources. If you have Medicaid, you know, some of the costs that I spoke about today would be different. Medicaid does help pay for some of those costs, whether that's premiums or copays, including some of your drug costs. So you do have to also do some additional research on if you're on Medicaid, because there's different levels of coverage for Medicaid as well, which will influence the cost that you pay.
Great.
And so, yeah, like I think that's the session. Really wanted to say Medicare is not one size fits all. I think we've spoken about it a lot. So happy to answer any questions.
Yeah, thank you, Richard. I want to make sure we take some time here and answer all the questions. There's quite a few questions here, so I'm going to open up the floor a bit. There's some questions. You can post them up in chat, raise your hand, whatever works best for you. So we'll try to leave some time here. I will also post something in chat. We'd love to get your feedback on these sessions, so I will post that in chat for everybody. If you want to click on the link at your convenience to fill out that feedback form, that would be great. I will read the questions in order that were sent in. There's quite a few, Richard. So,
okay.
You know, hopefully we can get through them all. I have a threshold. If I have a platinum health insurance plan that I intend to carry for the rest of my life, would I need Medicare?
Yeah, so I assume the Platinum Health Insurance is an individual ACA or marketplace type plan. It sounds like that's what it is. If you do have one of those plans, you actually are supposed to sign up to Medicare when you turn 65. Now, the reason for that is Medicare, you need to enroll in Medicare unless you have what Medicare considers is creditable coverage. And the only real exception for deferring Medicare is if you are on group insurance and you are still actively working. And that group insurance plan is with an employer that has more than 20 employees. So if it's less than 20 employees, doesn't count. And then individual plans don't count to being creditable. Cobra also doesn't count. That's an important one. People think that counts, but it doesn't. If you're on Cobra, you need to sign up for Medicare as well. So that's the long answer. The short answer is you do need to sign up for Medicare when you turn 65, and most likely you'll have to drop that Platinum insurance plan because it probably doesn't make sense to have both, or they won't let you carry both.
Great, thank you. What is the difference between copay and coinsurance?
Yeah, so both copay and coinsurances refer to the cost share that you have to pay for covered services. The difference between a copay and a coinsurance is a copay is a fixed dollar payment. So a copay will be something that says $5 if you see a doctor, or $10 for a specialist. A coinsurance refers to a percentage. So that will be, for example, you have to pay 20% of the costs of your doctor visit, or you have to pay 30% of the costs of the retail value of your drugs. So that's the only difference between the two. One is a fixed dollar amount, the other is a percentage, but they both refer to the cost share that you have to pay for covered services.
Great. Are mental health services treated as the same as medical health services?
So it depends on the mental health service. So for Medicare Part B, it will cover anything that's really considered medically necessary, and so they do cover things like sessions for mental health. And then Medicare Advantage plans, they'll also have coverage for therapy sessions, and they'll typically say it's a fixed copay for an individual session or of X, and a fixed copay for a group session of Y. So they are covered under the Medicare plans.
What is the estimated percentage of doctors who accept Medicare?
Yeah, it's a good question. It's about 94%, I think, is the most recent estimate I've seen. So a lot of doctors do accept Medicare across the country. So there's only a very small percentage who do not.
How are premiums determined?
Yeah, it says for the 90 to 3. Yeah. So the premiums for the Medicare supplement plans, it's really based on geography. There's a complex calculation behind it in terms of how the insurance company calculates the risk of the pool of people that they're insuring. And so it depends on your geography. It depends on the cost of healthcare services in your area. And so the example I gave earlier, in Dallas, a plan G, I think was $110 or around that for someone who's 65. In New York City or New York, that's probably $280. So it just depends on where you are geographically. And then the second thing that plays into it will be, your age, as well as potentially your health status. So as you get older, most of the plans will start charging more. They step up as you get older. And the second is, if you ever join a Medicare supplement plan, outside of the very first time you sign up for Medicare, where there's guaranteed issue, they have the ability to underwrite you based on your health, and you might be charged a higher premium because you have, health condition.
Very good. Okay, so we have another question here that's a little bit longer. As we evaluate options with various Medicaid Advantage plans, is the plan required to disclose what tier each drug is in? Can the plans change the tier's assessment at will? Basically, can a med go from a tier 2 to a tier 4 at the whim of the Advantage plan?
Yeah, so the plans do have to disclose which tier. your drug is covered in. And so that's when you go talk to like an expert or you work with us at CoverRight, that's what we're doing on the back end. We're actually through the technology putting your drugs in, and we're searching through each plan and the tiers that they've allocated to that plan. So you can get those. Each plan will have what's called a formulary list. It's a long document that's got all the drugs that they cover under that drug plan. And they will say what tier that drug is covered under. And then secondly, can they change? They can. It's not really at the whim. They do have to go through hurdles to make that change. Typically where you see if there is a change will largely, by and large, be between each year. And so that's why we say it's really important in Q4 during the open enrollment period to just do a check on the drug costs, because they can change from year to year. The plan can change the tier. But it's not really like throughout the year at the whim. I mean, they have to go through some hurdles to do it. And if they do, you'll most likely see it happen between the calendar years. So that's why you should compare an open enrollment period.
I don't know if this one's a question or a statement. In Medicare Advantage, you can go out of network, but you pay more, just like in a regular non-Medicare plan.
That's right. So in a Medicare Advantage plan, if you have a PPO plan, a preferred provider organization plan, you can go out of network. The plan will typically cover it at a higher cost. One big thing to note is for the PPO plans, the plan will cover if you go out of network. You also just have to make sure that it's important to understand that the out-of-network doctor must also be willing to accept that plan. So it's slightly different to a Medicare supplement plan, where as long as they accept Medicare, they'll service you. If you're in a Medicare Advantage plan and you're going out of network, that out-of-network doctor needs to be willing to accept your plan. And if they do, then your plan will cover it, and you pay the higher cost. But it's a double opt-in.
Great. Can you talk about the underwriting for Medigap plans, or is that covered in the next session?
We might cover it in the next session, but the underwriting, so on the Medicare supplement plans, there's two ways to get it. One is you get it through what's a guaranteed issue period. That means that's a period where you can get it no matter what, and you can't be charged more than anyone else, and they can't ask you health questions. In most states, and for most people, that only happens once. That's the first 6-month period after the very first time you get Part B. So that's the best time to get a supplement plan. After that, if you ever go through underwriting, they'll basically ask you a bunch of questions. Typically, there's a few knockout questions, and they'll be around, have you ever had cancer? Have you been in the hospital for the last, in the last 12 months? Do you have any sort of serious kidney disease? There is a list of questions that are common for knockouts. And then once you dive into the more detailed sort of things that aren't immediate knockouts, then you'll start getting into individual company underwriting, and that's going to be things like how far do they look back. So some companies might say if you've had 2 years clean bill of health, then it's great. Some might say it's 3, some might say it's 4. It will start becoming nuanced, and that's where an agent can help navigate that.
Good. Can you switch from an Advantage plan to a regular Medicare with a supplement?
You can. If you're in an Advantage plan, you can switch in Q4, so during open enrollment. The reason for that is when you're during open enrollment, you can switch either to another Advantage plan, or you can switch your Advantage plan just to a standalone prescription plan. And when you do that, you can also get the Medicare supplement plan.
For drug coverage, you can go to Medicare.gov and put in the medications and see which plans cover your drugs and which will give you the cost and show you which plan is the least expensive, correct?
That is correct. Yeah. If you go to Medicare.gov, they also have a system that helps to estimate your drug costs. And it's if you're looking for some information on what it would be for different plans, they do have that as well. I would say if you have a longer list of drugs or a more expensive list of drugs, it's worthwhile, even if you do it yourself, covering that with an expert, because we've had situations where we've looked into the underlying details of the calculation, and we've found that, hey, you know, maybe you should go talk to your doctor about this drug to see if you can find an alternative. And that way we might be able to save you money.
Great. Is there any other additional questions? I don't see any additional ones in chat. If anybody wants to unmute their microphone, you're welcome to ask any questions. We have a few minutes left before we wrap up. Did you have a question, Rebecca? Yes, please.
Well, I was just giving other people a chance, but I just wanted to say thank you, Lee. What a wonderful service. And Richard, great explanations. And your pacing was so good. I could really track. Fabulous. Fabulous. Thank you.
Thank you, Rebecca. Really appreciate it.
Thank you for all your questions, Rebecca. Great questions as well. All right. So we're nearing the end of our time together, and it's time to start wrapping things up. Thank you very, very much, Richard. It's been great having you here this evening to teach us about CoverRight and navigating through the very complicated world of Medicare that we all live in. Learn more about CoverRight by following them on social media. You can see this link in the chat that's posted up in the chat channel on the right side of your screen. And it'll also be included in the follow-up notes as well. Make sure, please join us next week. You don't want to miss Richard's wrapping up this 3-part series on May 19th, 4 p.m. Pacific time and 7 Eastern time. We'd love to have you for the last of these great sessions. Thanks to our audience here in the live studio and in the lounge. I also want to draw attention to some relevant classes on GetSetUp. If you'd like this event, one of our classes might be of interest to you as well. Look for the link to sign up for these classes in the chat here on Zoom or in our live stream at getsetup.org. And remember, everyone who registered will receive an email after the event with the follow-up links, plenty of notes, that's for sure, including links to some relevant classes that might fit your interest and other exciting upcoming guest speakers. We look forward to seeing you all in the future classes, and thank you, and have a great evening, everybody.
Thanks.